Hello, and welcome to the cabbage patch. No, not that kind of cabbage. Coronary artery bypass graft, often abbreviated as CABG, is a surgical procedure that is performed to restore blood flow to the heart. This is because the coronary arteries, which supply oxygenated blood to the heart, experience blockages, and the blood vessels need an alternate route. To do this, blood vessels are harvested from other areas of the body and used to create a detour. Typically during surgery, the patient is connected to a heart-lung machine that performs the functions of the heart and lungs so that the heart remains still during the procedure. However, other variations do exist, such as the off-pump approach, where the heart remains beating, or a minimally invasive approach, where the heart is reached through small cuts between the ribs instead of a larger incision down the chest. CABG is the most common surgery in the realm of cardiology. In fact, it makes up approximately 50% of all heart procedures. So how does someone end up needing this surgery? Well, most patients who undergo CABG have a condition called coronary artery disease, when levels of LDL, or bad cholesterol, remain high in the blood, an inflammatory response is triggered. This in turn creates a buildup of plaque, which contains cholesterol, fibrin, and blood cells. If plaques in the coronary artery are left untreated, these blockages can result in myocardial infarction, also known as a heart attack. CABGs are performed to reduce this risk. In terms of the types of blood vessels, or conduits, that can be utilized for CABG, surgeons have a few options to choose depending on the circumstances. The internal mammary artery runs next to the sternum and supplies blood to the anterior chest wall. It is the most ideal conduit due to the higher long-term success with providing blood flow to the heart. The radial artery is located in the forearm. Although it is an effective conduit, it isn't nearly as ideal as the internal mammary artery due to its tendency for vasospasms and a higher chance of blockage in the future. The saphenous vein is located in the leg. Because of its length, using it as a conduit allows for multiple grafts if the patient has more than one blockage. That said, the main drawback is that from a cellular point of view, veins aren't designed to withstand the pressures that arteries often experience. As such, grafting using the saphenous vein is correlated with higher rates of occlusion and graft failure that require reoperation in the future. Therefore, despite numerous advancements since its inception in the 1960s, there is still a lot more to CABG that can be researched upon in order to improve surgical outcomes within patients. So far, studies have looked into the use of various pharmacological agents, stem cell therapies, and internal-external stents during surgery. Outside of the operating room, computational modeling can also be used to study blood flow within grafted vessels while accounting for hemodynamic stresses. Or, if you're like me and work in a research lab that handles live animals, in vivo models of bypass grafting can be created with mice, rats, and even larger mammals. Ultimately, continuing research on CABG will lead to clinical approaches that will improve patient outcomes. So go forth and grow that cabbage patch.